Thank you, Mihaela. So I'm gonna try to share what I have prepared for you today in about 30 minutes or so, 35 minutes, so we can hopefully get out on time. This day to me is really a milestone day. I think when I think about now, June 22nd, 2013, this was really a day that had many years in the making, in the sense of inspiration, a lot of forethought, a lot of planning, and a lot of care. I remember Mihaela and I speaking about this on many occasions throughout the year, so I'm glad that this has finally happened and taken place, and I hope this is the first of more to come. So again, like what's been said earlier, I applaud all you guys being here today, wanting to take an active role in your own health, and hopefully you guys feel like you're learning more by investing your time in being here today. So as mentioned, the UCLA Center for East-West Medicine has been a fixture here at UCLA. It's been around since 1993. We're located in Santa Monica, about 5 minutes away at Parkside. And I just want to share a little bit more about what we do and also sort of our perspective on stress and inflammation. So in the next 30 minutes, these are some of the goals I have for this talk. Some of these parts I'll probably speed through a little bit more since there's some overlapping recurrent themes that we've heard about already this morning, and then spend a little more time on perhaps some of the things you haven't heard of yet. So today I want to review some of the key features of integrative medicine, discuss the burden of chronic symptoms and disease. I'd also like to describe some of the physiologic effects of stress. How does the stress affect the body? Illustrate the concept of allostatic load, and then introduce the East-West perspective on stress and inflammation, and then lastly, equip you with self-care. So pretty ambitious. I got a lot of things I'd like to cover. Let's go ahead and get started. So I often share this quote when I give this talk, even to residents and med students and even other scientists and physicians, because I think it's an important statement made by Dr. Osler, and he's considered for many the father of modern Western medicine, and he's often known for his quotes. And this is one of his quotes that he makes. The study of medicine begins with the patient, continues with the patient, and ends with the patient. I think that's very important because we can't lose sight of the patient. Many times, and perhaps you guys have experienced this yourself, is you may feel that, that we as physicians may look at the symptoms, the diagnosis, the problem list, the blood test result, the MRI finding, or your list of medications, but don't really think about the person with these findings. And what I mean by that is that many of you may have fibromyalgia, 10 of you, 20 of you, but the thing is not all of you are the same. And we can't treat you like a textbook, right? We have to treat you as an individual, a person with fibromyalgia. So keeping that perspective in mind, we can't lose sight of who's in front of us. So when we talk about not losing focus of the patient, what we're really discussing is patient-centered care. Patient-centered care is one of the hallmark features of integrative medicine. When I describe patient-centered care, really it's individualized care. Some of you may be familiar with the term N equals 1, because when we do studies, we're talking about N equals a large number. We're looking at large samples, and we're basically looking at the average of the norm, okay? But we can't treat people that way. We have to treat them as a person, and specifically what's going on with them at this point in time. Integrative medicine not only values patient-centered care, but also talks about or implements a holistic approach. And some of you may have heard this before, and I just really want to describe holistic approach means taking the person as a whole. And that's really important in getting to know your patient, whether it's how they're sleeping, how they're exercising, what their exercise habits are, what kind of dietary things they incorporate or avoid, how are they managing stress, what kind of stressors are they experiencing right now. All that is going to inform their presentation. And practically, for me as a provider, it's going to help me decide what's the practical point of intervention for them in terms of education. The other thing that integrative medicine looks at is it utilizes all appropriate therapeutic modalities, which means conventional, non-conventional. So it's very broad. Conventional meaning Western medicine or biomedicine. Non-conventional can mean Chinese medicine, Ayurvedic medicine, chiropractic work, and so forth. But anytime you get a talk on integrative medicine, it should not discount the value of Western medicine, okay? Western medicine is still vital, very important, yet at the same time we recognize there's some limitations and shortcomings. And perhaps that's where non-conventional things like Chinese medicine may help make up the difference, okay? So when we talk about integrative medicine, our brand of integrative medicine at the center is East-West medicine, which takes the best of Chinese medicine, try to incorporate that with the best of modern Western medicine. Integrative medicine also values leveraging the body's ability to heal itself through self-care. How many of you guys believe in this concept of the body's ability to heal itself? That's great. And some of you may have a harder time recognizing this because your symptoms perhaps have been very, very chronic. And you forgot what it's like when things were in a healthier state, when things are quote unquote normal, when you may get a cold or an infection and it just takes a couple of weeks maybe and you're better and you're back to normal, back to work functioning. Whereas, when it takes 2 months, then you start to realize there's something going on here. My body's ability to heal itself, that mechanism is no longer intact. I need the help of someone else. But we have to encourage this response. How do we do that? Hopefully I can share some of that with you today. Integrative medicine should emphasize prevention and wellness, and that's really, as I mentioned, should be the case with all of medicine, including Western medicine. All good medicine emphasizes prevention and wellness. Wellness, as mentioned earlier, should not just be the absence of disease, right? It should be promoting health, and how do you maintain health? And prevention should not just be immunizations, vaccinations, and screening exams. And prevention should be, what are you actively doing in your own day-to-day activities that are playing an active part in helping your situation, okay? So I'm going to talk about a different way Chinese medicine looks at prevention in terms of in the clinical setting. It should be informed by evidence. We want to know, does it work? How does it work? But more importantly, I think we want to know at this point is it safe? We want to know that's very important, and we need to study that because right now, although studies are being done, there's still a lot of information that's lacking. And as I mentioned earlier, integrative medicine is varied in its practice. At the center, we practice East-West medicine. Some of you may have heard of this consortium. It's called the Consortium of Academic Health Centers for Integrative Medicine. This is made up of 50 member institutions, academic health centers, including UCLA. Together, they came up with this definition of integrative medicine. It's the practice of medicine that reaffirms the importance of the relationship between practitioner and patient, focuses on the whole person, is informed by evidence, makes use of all appropriate therapeutic approaches, healthcare professionals, and disciplines to achieve optimal health and healing. So I think that's what we try to do at our center. And the idea here is that we have to take into account all things, what's best for the patient. And really, the integrative medicine, I think, has emerged because we are in a healthcare crisis, okay? And as you always hear over and over again, especially through these campaigns and with change in health policy, how do we lower the cost of healthcare? Because it's not sustainable. And part of the reason why we're struggling is because we don't know how to effectively manage chronic disease. So chronic symptoms and chronic disease has a large burden on our healthcare and our society. According to the CDC in 2005, 133 million Americans, almost 1 out of every 2 adults, had at least one chronic illness. And medical care costs of people with chronic disease accounts for 75% of the nation's $2.3 trillion medical care costs. Chronic disease accounts for 70% of all deaths in the US. The vast majority are preventable. 8 out of the top 10 causes of mortality for adult men and women in the US involve an inflammatory process. We're going to key in on this a little bit later. But the idea here is that we have a lot of work to do. And many of you here suffer from a chronic disease or chronic symptoms. How do you solve the healthcare crisis? Well, that's a big debate. Many things can be talked about. But when it comes to how do you approach the patient with chronic disease, I think that East-West medicine has a lot to offer. Ultimately, what it comes down to is you got to solve the problem, right? If you solve the problem, if you help the symptoms, that's going to end the workup. That ends the workup. You don't need to be seeing more specialists, going to the ER, being admitted to the hospital. So what are the common problems that people struggle with that we haven't solved? Many people, it's pain. And I think for some of you, you probably can experience this yourself and fall in one of these categories. But it's because of these symptoms that people seek alternative medicine. Some of the top 10 symptoms for which, or conditions for which people seek CAM include here back pain, neck pain, joint pain, arthritis, anxiety, cholesterol, head or chest cold, other musculoskeletal symptoms, severe headache or migraine, and insomnia. Perhaps you identify with one of those here in this list. But many sources are looking at how common is the use of CAM for rheumatologic patients. And some sources cite as high as even 90% of patients, for example, with rheumatoid arthritis, use some form of CAM therapy. they must find some value in that, but also I think it points to our struggle in trying to help them with just conventional medicine alone. The other way I've looked at the same study, this was done by NCAM, also looked at the prevalence of use of CAM through the ages. Here you'll see that in adulthood it's quite common, and then it remains common throughout the adult years into their 8th decade. And I think it points to trying to help with chronic symptoms, chronic disease. So back to this slide, because I think I wanted to now focus in on this last part here. 8 out of the top 10 causes of mortality for adult men and women in the US involve an inflammatory process. Inflammation. How many of you here, raise of hands, suffer from inflammation? How many of you who aren't raising your hands know of maybe a family member or a loved one who suffers from inflammation? I think if you look at all the hands in total, just about all of you have risen your hand. And I think at the end of this talk, for those of you who haven't risen their hand, probably will realize that you or someone else you know suffers from this as well. In order to make a dent into chronic disease, we have to do a better job of helping manage inflammation. That's what it comes down to. And then first it's trying to have a little more insight as to what causes that, what drives it. So let's go back to sort of first year medical school for us, but I like to cite a very reputable resource here, Wikipedia. And how do they define inflammation? Inflammation is the first response of the immune system to infection or irritation and may be referred to as the innate cascade. Inflammation is characterized by 5 things, including redness, heat, swelling, pain, dysfunction of the organs involved. Okay? So the classic sprained ankle, twist your ankle, it gets red, it gets swollen, it gets painful. After 1, 2, maybe 3 weeks, all those things help to resolve, pain goes away, ankle is back to normal. That is an acute response to an acute irritant. But the idea here is that we're all wired to have inflammation, okay? And it should be an on-off response, okay? But at what point does inflammation then become chronic that then leads to chronic symptoms? So when we talk about chronic symptoms, we lead to chronic disease, and it really became something more into the forefront of our minds when this Time article hit the press. I think it was 2004, titled "The Secret Killer: Linking Inflammation with Things like Heart Attacks, Cancer, Alzheimer's." But the thing is, it doesn't just affect the heart and the brain. Inflammation can attack any organ system in the body. It doesn't spare any organ system. So not only does it cause heart attacks, it can affect your lungs, leading to asthma or bronchitis. It can affect your nerves and your brain, causing strokes. Obviously, your joints, and for some of you, you suffer from rheumatoid arthritis or lupus or osteoarthritis. Hormonal imbalances causing metabolic syndrome and thyroid issues. Our gut affecting us with inflammatory bowel disease like Crohn's disease, ulcerative colitis, or GERD. Dermatologic conditions like eczema, psoriasis. Women's health issues like pelvic inflammatory disease, endometriosis, even affecting our kidneys, our bladder, leading to nephritis or cystitis. And basically, whatever disease you have determines what specialists you see. But you still have an inflammatory process. Okay? What is the larger systemic process going on that is driving this, that leads to this manifestation? We don't want to work downstream, right? We want to work upstream. How do things get affected in terms of dysregulating certain, we call them physiologic cascades, that then manifest with these and organ damage? So many people no longer see inflammation as a secret. Inflammation is well documented and leading to chronic disease. But stress is often not recognized as playing a vital role in inflammation and chronic disease, even though we recognized it in 1983. Seeing here, stress is seeking the cure for modern anxieties. So, raise of hands, how many of you guys are stressed? I think rather a lot of you are here. How many of you guys think stress affects your health? So I think that you agree then with the American Psychological Association. 43% of adults suffer adverse effects from stress. 54% of Americans are concerned about the level of stress in their everyday lives. 2/3 of all office visits to family physicians are due to stress-related symptoms. Are we addressing it 2/3 of the time, though? Stress is linked to 6 leading causes of death, including heart disease, cancer, lung ailments, accidents, cirrhosis of the liver, and suicide. You see another recurrent theme here. stress is much like inflammation. Dr. Say Lee, who really thought a lot about stress and contributed a lot to this field, recognized that over 60 years ago, stress activates certain physiologic cascades that only protect and restore, that not only protect and restore, but also damage the host. And that sounds very similar to inflammation, right? So stress and inflammation affect us physiologically, that when that response is no longer short-lived, it becomes chronic and therefore can lead to damage of the host. And stress, just like inflammation, can affect us from head to toe, right? When you guys are stressed, you probably recognize it. Certain symptoms may come to mind. Maybe you have a little bit of neck and back tension, or maybe you have some tension headaches. Maybe you have some irregularities of your bowel. Maybe you feel a little bit irritable. Stress can certainly cause mood changes and headaches. You see here, memory problems, trouble thinking, as people describe as a brain fog, trouble concentrating. People recognize that when they're stressed, they get breakouts, whether it's acne or eczema. You see it affects your muscles and your joints, primarily through tension. You get more pain. Also your heart races, your blood pressure goes up, and sugars released into your bloodstream can increase your risk of diabetes. Your stomach and your whole gut can get affected with nausea and heartburn, but also diarrhea, constipation, and irregular bowel movements. And for women, they have more painful periods. It can affect their fertility, as well as the compromised immune system, when you're more susceptible to infection, or it's taking longer for you to recover from an infection. Okay? So inflammation and stress, you can see, can affect all parts of the body. Now I want to introduce this concept of allostatic load, basically describing in another way what we've been talking about this morning. Dr. McEwen, he refers to the physiological response to stress as allostatic load. He describes it as the ability, allostasis is the ability to achieve stability through change is critical to survival. Through allostasis, the autonomic nervous system, the hypothalamic pituitary adrenal axis, cardiovascular, metabolic, and immune systems protect the body by responding to internal and external stress. Over time, cumulatively, this leads to allostatic load, and the overexposure to mediators of neural, endocrine, and immune stress can have adverse effects on various organ systems, leading to disease. So long definition, ultimately what that means is stress has a cumulative effect to the point where the host can handle certain things to varying degrees over time until it reaches a point of no reserve. You may describe it as maybe taking your finals, not getting enough sleep, being stressed because you got a job interview, and then bam, you get sick. And then it takes 2 months to recover, and he said, ever since then, my life has been different. The same is true like if you may have a single mom, maybe on early bed rest, had a pregnancy and then delivery that was complicated, had to stay home because the baby maybe had issues. There's some stress revolved around that and having to get back to work, otherwise may lose their job and lose their health insurance, and then is forced to go back to work even though she'd rather be home with her child. And they talk about how my life has been different ever since then. The body can take a certain amount of stress. At what point does that reserve run out? It varies on the individual. But at some point, that reserve is gone. It's at this point the person is vulnerable to a trigger that can lead to a disease or a symptom. Another way of picturing this is all of us have a physiologic response to a stress, and basically that this response is mounted and then there's a recovery period. That's normal. Okay? And then if you're subjected to repeated stress or repeated hits, you have this response and it comes back down. Response, come back down. That's what it should be like. But then if you have prolonged repeated hits of stress, you start to lose this recovery phase, and then this response becomes more blunted. And becomes more blunted, you cannot adapt, and that's when you're susceptible to a trigger, and then you can no longer mount a physiologic response. That's sort of the Western medicine way of perhaps explaining, how does stress then eventually affect all these different cascades in our body that leads to inflammation that then attacks my joint. Chinese medicine looks at it in a similar way, just describing it differently, but provides more finer details. And before I go into that, I want to emphasize this important point about how we view disease, how we picture the problem. Dr. Osler, again, makes an important statement. His quote, "Why is the right judgment on this one point, the nature of disease, the aim of medical education and of research, the be-all and end-all of our efforts? It's because upon correct knowledge depends the possibility of the control of disease and upon our views of its nature, the measures for its prevention or cure. If we're going to help the patient and solve the problem, what's going to determine our treatment plan is what we figure, how we picture the problem, what's generated this problem, what's led to this problem, and how we're going to intervene. Because if we don't identify that, then a lot of what we do isn't going to amount to a significant long-term change or effect. So Chinese medicine has a different way of viewing the nature of disease. And so Chinese medicine basically gives us another lens to look through when looking at the patient. Western medicine lets us see through one set of lenses. Chinese medicine filters things through another set of lenses and allows us then to make different observations. So this is relatively new, I think, to you. I'm going to try to cover this with the remaining time I have. The basic idea is that when we have health, there's a proper balance and flow of energy called qi. And when there's disease, there's stagnation or deficiency of qi. That's the basic, simplest way of looking at health and disease. And we think of a healthy person, you think of an active person moving, right? When we talk about movement, it incorporates this concept of balance and flow. In order for us to move fluidly, we have to have a good balance, and our body is moving, right? We can become deconditioned. That's when chronic symptoms set in and our pain gets worse. So stagnation is a term used in Chinese medicine. When things become stagnant or this energy becomes stagnant, that's when symptoms and disease can follow. When we think about qi stagnation in Chinese medicine, we think of it in terms of stress in Western medicine, or just sort of simple terms. Okay, so when I say qi stagnation, I'm talking about stress. Okay, how does qi stagnation or stress manifest within the body? It goes back to this concept of flow. Okay, flow, and we can appreciate this hopefully when we think about our bodies as blood flow. When you have a stagnant circulation or blood flow is compromised, that's when people are susceptible to clots and plaques that lead to heart disease, heart attacks, strokes. When they have compromised digestive flow, things aren't moving well from top to bottom. They start to get irregular bowel movements, bloating, distension, nausea, reflux. Things are going in the wrong direction. The flow is compromised. Airflow. Okay, you think about patients with bronchospasm, wheezing, or asthma. They don't get good air exchange. They get shortness of breath. They feel like they have cough. They can't breathe well. Menstrual flow. People describe irregular menses, clots in their blood, a lot of pain or other associated symptoms with their cycle. Urinary flow. People describe urgency, frequency, and incontinence. But ultimately, what it comes down to is muscle tension. What does stress do to us? It tightens us up. We basically become a ball of tension, and that is a picture of stagnation. Okay? And we have to somehow get things to open up. Okay? That's the simplest way of thinking about how we're going to treat the effects of stress. We have to get things to open up. Okay? And when we develop muscle tension from stress, it leads to pain, it leads to knots, and ultimately what we define as trigger points. Okay? So when we feel for these trigger points, I mean, that's really what we're trying to do in our clinic. And we have to identify them and address it by stimulation. So trigger points are localized, very hypersensitive areas in the skeletal muscle along the neck, back, and head, shoulders. You guys can, I'm sure, identify with this yourself. Sufficient pressure will intensify or mimic the pain and reproduce certain pain patterns of referred pain. And basically, you're stimulating this knot, this point, to result in a twitch response to de-trigger the point. And that results in relief of pain when it's inactivated. So the idea here is that people, when they're under stress, develop myofascial trigger points. That can become localized to the shoulder, neck, and the head, or the back, but then it can also become generalized. And if it becomes generalized, we appreciate this more in terms like fibromyalgia, right? Although this is not something required now for the diagnosis, it's often associated with the diagnosis. Okay, so you'll see here generalized myofascial trigger points. So there's a continuum or a spectrum here. When you have localized myofascial pain, you cannot ignore that because you want to prevent it becoming generalized myofascial pain. When you get generalized myofascial pain, then you can start getting smooth muscle dysfunction. When you get smooth muscle tension or dysfunction, that's when you get airflow issues, GI issues, urinary issues, circulation issues. So in order to treat the smooth muscle, you have to treat the skeletal muscle. And this concept is well appreciated with acupuncture because there's a broad overlap between myofascial trigger points and acupuncture points. In fact, there's a 90% correlation between these. So how do we treat the smooth muscle? From a Chinese medicine perspective, you intervene by stimulating acupoints, because in that sense, you're de-triggering the trigger points. It's like micro trigger point injections without anything being injected, okay? So when you get myofascial pain, you have muscular issue, but it's all interconnected. You may have arthritis, you may have degenerative disc disease that causes certain muscles to compensate. It's a stress on the system that causes the muscles to tighten up. You may have a nerve issue that can also affect the muscle too, or vice versa, and that's why people develop nerve-like symptoms when they have myofascial pain. But you treat the muscle tension that decompresses the pressure off those nerves that go through the muscle, and you can help the nerve-like symptoms, the tingling, the numbness, and the referred pain. And then you'll see here that you affect the skeletal muscle, you can help all these different organs in the smooth muscle, as well as the vasculature. So when I talk about stress, I mentioned chi stagnation. When we talk about stress, you got to talk about chronic, repetitive, cumulative stress. I think here, there's just different ways of thinking about stress, whether it's physical, emotional, social, mechanical. I think these are sort of self-explanatory, but cannot be underemphasized. We have to do an intake on this, right, in order to really get a sense of what's contributing to the problem for this particular patient. Chronic stress, cumulative stress, Chinese medicine generates heat. For those of you who know Chinese medicine, the concept of stagnation is whenever there's stagnation, it generates heat, okay? So I use the analogy of the car engine. Some of you, my patients here, may have heard me use this analogy before. But when the body gets overworked, when it gets overstressed, it gets overheated, okay? And the idea is that all of us generate a certain amount of heat every day. If we don't find a way to clear it, it results in symptoms. Now, what does heat do in the body? Heat does in the body the same thing it would do in nature. So if you were to see a wildfire, or if you were to see steam, what it tends to do is that heat rises and expands. In the body, it does the same thing. That's why people with heat develop a lot of symptoms in their chest up and a lot of symptoms towards their hands and their feet. So you get heartburn, you get nausea, you get sore throats, you may get breakouts, you may get headaches, you may get ringing in the ears, you may get high blood pressure, restless mind, insomnia. Or you may also get joint pains. You may get some rashes breaking out in your extremities, okay? Heat tends to rise and expand in the body. That's how it can manifest. So what are the causes of heat? I really spent some time on stress, but we can't ignore diet. Diet is number 2. For some people, it's number 1, but it cannot be ignored. There's what we consider energetically warming and hot foods. So if people have inflammation, if you think of that as heat, we have to minimize the amount of heat they generate. The way you do this is you minimize energetically warming or hot foods, and you introduce more cooling foods. Not cold temperature foods, but energetically cooling foods. Dietary preparation becomes important, and as mentioned earlier this morning, lack of sleep. The engine has to be turned off. If you keep that engine turned on, eventually it's going to overheat. If it doesn't overheat, when you rev it up under stress, then it's more prone to overheat and break down. Same idea, we have to turn the engine off. In fact, there's been a study done, just really worth mentioning, normal patients, sleep deprivation, check blood test, next morning found that their inflammatory markers are already elevated. For normal patients. So those with cumulative sleep loss have a chronic reason for having chronic inflammation. We got to address sleep, okay? Emotions. It's not just the stress of emotions, but the important aspect here is unprocessed, internalized emotions, okay? You have to let it out. I talked about this ball of tension, you got to open it up. If not, it's going to combust. I talked about this idea about sort of like a pressure cooker. You all generate heat. If you don't get the release valve, it's going to explode. And that's probably why many people feel very irritable, on edge, like they just have to let something out, okay? That's a heat sign. That's why you hear this phrase, I'm so angry, my blood's boiling. Or someone's so angry they develop red face and bloodshot eyes. That's a sign of heat, okay? Medications, steroids and chemotherapy, radiation treatment is a form of heat being introduced into the body. So whenever appropriate, whenever we can, we want to try to reduce the steroids or reduce those other type of medications that can contribute to the heat pattern. So we're generating heat. Well, how do we clear heat? What does our body do when we're hot? We tend to sweat, right? We tend to sweat. And the other way the body clears heat is through bleeding, okay? Through bleeding. And the best way to appreciate this is through menses for women, okay? If you have a lot of heat symptoms or a heat pattern, they'll tend to get worse before your menses. And then on the onset of your menses, as the heat flows out through the blood, your symptoms tend to improve if you have a heat pattern. So when this mechanism is knocked out, when a woman becomes menopausal, they develop heat signs. Heat symptoms including hot flashes, night sweats, feverish, dryness, and irritability. Okay? So we have to find other ways for the body to clear heat at that point. Hydration becomes important. Back to the analogy of the engine, we need the coolant. You don't have the coolant, you're more likely to overheat. So you want to drink enough so that your urine's pretty clear. Regular bowel movements, this is the exhaust. We have to find ways to get elimination, get the toxins and the heat out through regular defecation. Okay? If the patient's constipated, you have to address that. The other thing worth mentioning is when you have bloody bowel movements, that can also be another sign of heat. Okay? Because the body is trying its best to find a way to clear heat, and sometimes it does it through bleeding. Nose bleeds, gum bleeding, blood through the stool. Okay? Crying, that's another way to clear heat, and that's also a good treatment for red eyes. Okay? And adequate sleep, that's another way you clear heat. You got to turn the engine off. So, reducing heat. We talked about generating heat, clearing heat. How do you reduce heat? Goes back to stress reduction, stress management. I think we're going to learn a lot today from Dr. Sidoroff. Examples of ways to relieve stress is through slow, deep breathing. You probably notice yourself when you're anxious, rapid, shallow breathing. When you're overwhelmed, you're overstressed, kind of just take a big sigh, right? It's your body's way of reminding you to slow down, turn off the stress response. Deep breathing is a way you do that. Meditation and prayer, a very effective way. That's what I do. That helps me. Journaling, this can be very effective for people who have no outlet, can't talk to anyone about their stress, but they can express it through writing. And no one has to read that, but it's not going to be recycled in your mind. Hobbies, finding pleasurable hobbies. The key to all these things, you got to do it consistently because all of us develop stress on a regular basis. Okay? Minimizing warming foods, increasing cooling foods, anti-inflammatory diet. What are some examples of warming or hot foods? The best way to think about it, if you have reflux, these are the things you have to avoid. Heartburn is a heat pattern, but not just for reflux. Anyone with inflammation, you got to be careful with these things. Okay? What generates heat? Alcohol. People drink alcohol, sometimes you see them get flushed. You know that's a sign of heat being introduced. Caffeine. We talk about stress as a way to generate heat. Well, caffeine is a stimulant. It's going to mimic the stress response and get your engine revved up, right? And that's going to create more muscle tension. Chocolates, another way of energetically heating up the body. Red meats, nuts. If you go back to chemistry, for those of you who took chemistry lab, I remember this vividly because when I had a peanut, I would light it up and it would just keep on burning, keep on burning, keep on burning, because there's a lot of energy in the nut. For some patients, that's good, but if you have a heat pattern, you gotta be careful if you're just eating a handful of nuts all the time, okay? And then food preparation. Food preparation becomes really important too, not just the food itself, but how do you prepare it? Is it being barbecued? Is it spicy? Is it deep fried? Those are adding more energetic heat into the food before you introduce it into your body, okay? So what are some cooling foods? Fresh fruits and vegetables. For sure, the general rule of thumb is if it's in season in the summertime, then it tends to be the most intrinsically cooling food. Hard to appreciate now because we get food from all over the world, and basically there's no seasons anymore. But basically the things that go on sale right now during the summertime are the things that are in season. Those are the ones that are energetically cooling. Tend to be melons like watermelon, honeydew, cantaloupe, and berries. And then fresh vegetables, you think of cucumber, celery, leafy greens, lettuce, things like soybeans if you can handle soy. Cooling tea. Now, these are all general rules of thumb. Now, I'm not saying everyone has to do these things because sometimes you may have a particular sensitivity. And if that's the case, and for that individual, you don't want to take that. But if not, these are things to consider. Cooling foods also include cooling teas. And a lot of my patients, you probably know that I like to emphasize teas because they're really easy to do and take with you and drink. Because like when you're stressed, you drink your mint tea, like I'm doing right now. So. Right? But you have your mint tea, you have your barley tea, you have your flower tea, and any of the flowers generally are considered cooling. They're calming, they're relaxing. That's why you'll see chamomile, you'll see passion flower, you'll see chrysanthemum. Okay? These are often used to help inflammation and heat patterns. Then there's bitter tasting foods. We don't have much of this available to us because we don't like the taste. But if we ever had to talk on Chinese nutrition, there would be a lot of emphasis on taste. And one of those tastes is bitter. In fact, studies have been shown that just introducing the taste of bitter in the mouth already stimulates digestion in the body. And what does bitter food tend to do? It helps promote bowel movement and promote elimination. Because really the only way you get rid of heat, you got to remove something. If you go back to that slide about defecation, urination, sweating, bleeding, you got to get something out of the body, right? So that's what bitter foods do. It helps descend and bring things out. Dark green vegetables can be bitter. A good green tea can be bitter. For those of you who know this, bitter melon is very bitter, but very effective. to clear heat. So we talked about generating heat, clearing heat, reducing heat. How do you treat heat? What we do in the clinic is we do acupuncture and acupressure. We teach patients how to do pressure points. We do trigger point injections with lidocaine or sometimes vitamin B12. We don't use any steroids. We also incorporate, as I mentioned here, Chinese nutrition. We don't do herbal medicine, but the same principles apply. In fact, herbal medicine, a lot of good examples of herbs are dietary herbs, like mint, like barley, like chrysanthemum. The anti-inflammatory diet, restorative sleep, and acupuncture, acupressure is great to help people with sleep. Stress management, stress reduction, mind-body exercises, we'll talk a little bit about that later, and then appropriate medication reduction. Can't lose sight of this. And I don't want to say that medication is bad, because like we were saying, Western medicine, especially when it's critical, a severe flare, you got to save and salvage the organ, you got to use medication, right? You got to save that and get them at a point where they can then incorporate more of the self-care things so they can get off the medication. That's the important part. Okay, so self-care, the essence of self-care goes back to what you do on a daily basis, right? What do you do on a daily basis? You have to address the stress. You have to address the diet, eating appropriately for your constitution and your presenting complaint. This is a moving target. Hydration, you get adequately hydrated. Appropriate exercise, not over-exercise, and certainly not doing enough exercise. Quality sleep. As I say, exercise and sleep are the best medicines. The best medicines. You got to work on this. And appropriate medication reduction. So you do these things, can help you get off the medication. And that leads to a pattern change. Chinese medicine, we talk so much about patterns. Identify the patterns, and then that leads to the result. If you don't change the pattern, you don't change the result. Okay? And I'll leave you with this proverb. If we don't change our direction, we're likely to end up where we're headed. Okay? So, just want to thank you. I'm sorry we went through that really quickly. I just want to say just one more slide in case you guys are interested in learning more about our center. This is our website. It's also on our cards and our brochures. If you're interested in learning more about integrative medicine, this is a website that our center team has developed and constantly updates about announcements, articles, interviews about integrative medicine. And then we have a UCLA extension course actually starting next week. We've been doing this for quite a few summers now on integrative medicine for those of you who are interested in being in a classroom setting and hearing experts speak about various important topics within integrative medicine. Lastly, just want to say that this day wouldn't be possible without not just the volunteers and the physical manpower, the resources by the Department of Medicine to support us, but moving forward, in order to make this something grow into something larger to help more people, we need partners. We need partnership. And so for those of you who know of people or personally, or know of foundations, corporations, academic institutions who want to collaborate to help support the work to move this forward, to help people with chronic disease like arthritis and chronic pain, please let us know. Come up to any one of us and share your ideas, because that's how this came about. And we want to do this for more people in the future. Thank you.